Next up, we have Representative Saunders, House Bill, Committee Substitute for House Bill 1225. You recognize Representative Saunders.
Thank you, Chair. Thank you, Mr. Chair, for the opportunity to present House Bill 1225. This is an important bill. I'd like to start by thanking Representative Cary Pigman for partnering with me as my primary co-sponsor, and also Representative Renuard for his co-sponsorship as well. HB 1225 seeks to increase access to HIV testing and treatment and reduce the rate of infection in our state by reducing barriers to testing in a healthcare setting. Once passed, a doctor could offer an HIV test verbally, and the patient could accept or decline verbally, but no written consent would be required. The bill does preserve the informed consent standard in a non-healthcare setting where HIV tests are being conducted out in the community by people other than healthcare professionals or their staff, and I do believe there's an amendment.
Okay, Representative Pigman, you're recognized for the amendment.
Thank you, Mr. Chair. This amendment, this friendly amendment, simply takes the good advice from the AIDS Institute, which is a nationwide advocacy group for early diagnosis and treatment, HIV and AIDS, and also research in AIDS, and takes their recommendations to further streamline the screening process and incorporates their language. They are based in Tampa. Thank you.
Any questions on the amendment? Seeing none, we have no public testimony on the amendment. Is there any debate on the amendment? Seeing none, is there objection to the amendment? Seeing none, show the amendment adopted without objection. We're back on the bill. Are there questions on the bill as amended? Seeing none, public testimony. We have Spencer Lieb. AIDS Institute waves in support. Stephen Wynn. That's all the public testimony. Is there any debate? Representative Renuard in debate.
Thank you, Mr. Chair. Well, I certainly support this bill. You know, we need to start removing some of the stigmata that is related to HIV infections. There are thousands of viral infections, and I can test patients for things like shingles. I can test them for hepatitis, and I don't have to go through forms, and that creates a big obstacle for patients and physicians to do the testing. And it's been shown that early diagnosis can help decrease the spread. It can also decrease the risk to other healthcare providers, and it catches this before disease processes are advanced. So I'd certainly recommend your strong support of this bill today.
Is there any other debate? Representative Clark Reed, you recognize the debate.
Thank you, Mr. Chair, and thank you, Representatives, for bringing forth this bill. As you know, as we heard on the floor yesterday, that Broward County is the #1 in the AIDS epidemic, and I'm sure, hopefully, that this will help us to catch those cases early on and be able to work with eradicating this virus. Thank you.
Any other debate? Seeing none, would you like to close on the bill?
Sure. I'll thank Representative Pigman and Representative Renuard again for their leadership on this. It's been really wonderful to work with both of you, and I think there's a lot of work to do to end the epidemic, as Representative Clark Reed mentioned. When we get folks tested and we get them to know their status, they get into a continuum of care that can dramatically decrease the amount that they'll transmit it to other folks, and I think it's an important step we'll take, so I humbly ask for your support.
Thank you. Having closed, Bobby, will you please call the roll on the bill?
Representatives Ahern?
Yes.
Broder?
Yes.
Clark Reed?
Yes.
Cummings?
Yes.
Edwards?
Yes.
Gibbons?
Yes.
Harrell?
Yes.
Hudson?
Yes.
M. Jones? S. Jones?
Yes.
Murphy? Oliva?
Yes.
Petronis?
Yes.
Pigman?
Yes.
Renuart?
Yes.
Robertson?
Yes.
Wood?
Yes.
Chair Corcoran.
Yes.
Bill passes.
Show the bill reported favorably as amended. Thank you, Representative. Next up, we have